Hello everyone. So today we are going to discuss the range of motion techniques. So usually in the last lecture we have discussed the principles and the evaluation planning techniques. So today we are going to see what is range of motion techniques that we have to use as a foundational concept in a physical therapy. We will discuss how to apply them effectively, the role of gravity, patient positioning, like how to transition or how to transit from passive to active movement. So let's start from here. Okay, so majorly, there are that there are three types of range of motion. Okay, the passive range of motion, active assisted, and active range of motion. So it is basically the way in which we can approach a patient. Okay, starting from the passive, after that active assisted, and then active range of motion. Whether the patient is fully dependent or actively participating, these techniques form the foundation of mobility training. Okay, as you know that. So majorly what was happening here is, as you know that these are the passive range of motion, active assisted, and active range of motion. Like in passive you can perform patient cannot perform the movement independently or with their self. So as a therapist you can help, you can perform a movement for the patient. Active assisted is basically the participation of both. Okay, as a physical therapist, yours as well, with the patient contributing in that moment as well. Okay, like if patient can perform the if you can consider shoulder elbow flexion as an example. Okay, you can just perform a elbow flexion. Okay, so instead of performing the movement itself, you know that what is shoulder elbow flexion. Okay, we can just make a picture of that so you can easily learn from that. Okay, this is how the elbow flexion. Okay, you can take this as a humerus and the other is as in your ulna. Okay, so this is the elbow joint. Okay, starting from this position you can perform the complete movement of elbow flexion to reaches here. Okay, you know that. So what was happening here is basically when you can perform this movement or patient can perform this movement itself, that is basically the active range of motion. If you can, as a therapist, perform the complete movement on the patient yourself, it is basically the passive. And active assisted is basically the patient can perform maybe like here the half movement, and then after that the patient can say that it is so painful, I cannot tolerate that. So after that you can help the patient to complete that range, like uh, range of 120 or something like 80, 90. In many examples of that, basically the what kind of movement you can perform, it is basically depending on the degree. So patient cannot perform that movement itself or complete that movement itself basically. So you can help or assist the patient to complete that movement is basically the example of active assisted range of motion. Okay, so majorly you have learned that this concept, majorly the passive, active, and active assisted. So after that, you know that, okay, we can just scroll back. Okay, so in this concept we have discussed the types of range of motion. The second thing that we are going to discuss is the role of gravity. Okay, gravity can be your best friend or your biggest challenge depending on how you use it. Okay, basically how your patient uses that is basic depending on the patient condition, patient tolerance, patient's muscle strength, patient's basically, you can say that muscles work or anything like that. Okay, the first thing that we're going to discuss is movement against gravity. When a patient move a limb upwards against gravity, like shoulder flexion in sitting, so what was happening here, assistance may be needed, especially if muscle strength is poor. But this is the a condition when the patient can perform movement against gravity. Okay, like I have given you an example of shoulder flexion. You can just also take an example of elbow flexion as we have discussed before. So if you can perform the limb upward movement against the gravity, so sometimes patient can need an assistance, but if their muscle strength is good, they can perform that movement actively. But sometimes they need an assistance, so active assistant movement is performed. Second thing, okay, the first we have discussed is movement against gravity. Second one was the gravity neutral or gravity eliminated. Like in position where the limb move horizontally, like shoulder abduction in spine. Okay, the movement is already eliminated. The gravity is already eliminated because the patient is in the lying position, okay, in the straight lying position. So in this, the basically the gravity is eliminated with the help of your bed. Okay, so muscle work required a very minimum gravitational resistance, so you may only need to support the limb, not to assist it. Okay, so this is the second thing, like gravity eliminated, or you can perform the movement in the gravity eliminated. It is depending on the patient tolerance and patient condition as well. Third one was the with gravity, downward movement. When the part moves downward, gravity does the movement. Okay, you know that. When you can perform the elbow extension, not the elbow flexion. First, you can perform the in starting of the movement, you can perform the elbow flexion, or you can just fold the elbow, your elbow, and then you can just move that elbow back in the elbow extension position. So, what was happening here is basically gravity does the movement. Okay, gravity takes part here. Okay, so muscle opposing the motion, like the antagonists, are majorly control the movement, so they may require support to prevent collapse or unsafe motion, but not all the time. Okay, so always assess how gravity is acting on the limb and adjust your approach accordingly. Remember, always remember, okay? As a therapist, as a doctor, as a physical therapist, as a coach, as a trainer, as a sports therapist, you need to understand how gravity is acting on the limb to adjust according to your patient's need, your patient's tolerance, your patient's condition, your patient's requirement, everything. Okay, depending on the individual needs. Okay, your patient's need, your athlete's need, basically all of these things. The third thing is patient positioning, because patient, okay, the first we have discussed is what type of range of motion we are going to perform. Our second one was the role of gravity, and the third we are going to discuss today is patient positioning. So most range of motion techniques in clinical practice are done with the patient in the spine position. Okay, as a physical therapist, you have seen that the patients are always in the lying position and they are going to perform some kind of motions, but you can also adapt the patient conditions, or other alternate positions depending on the patient or depending on the region where you are going to target. So majorly the most movements are performed in the spine positions. Okay, for efficiency, perform all possible motions in one position. Okay, then after that you can switch to other position according to the patient needs. Okay, then change the patient position to minimize the unnecessary movement. As you know that the sometimes there are some other limbs are going to move, or some other joints are or some unnecessary movements are happening in on some other joints of the patient. So you can just eliminate the to eliminate those kind of movements, you can change the patient position according to the patient's requirement, or you can say see that the what kind of approach is best suitable for the patient, so you can just adapt to that. Okay, the fourth one was a therapist technique and safety. Every patient is different, as you know that, so you can adjust hand placement based on the body type, comfort, environmental factors. Everything is related to that. Okay, so basically, starting from very first, the therapist techniques and safety, because this is the fourth point. Okay, remember patient positioning, role of gravity, and the first one what we have discussed this types of range of motions that we are going to use in the ROM techniques. But the fourth one was the therapist techniques and safety. You know that as a therapist, there are many kind of movements are happening in your body as well when you can perform the any movement on your patient. So you need to take care of yourself at the same time you can take care of your patient. Okay, in the same way. So you may need to adjust your hand placements based on the body types, comfort, environmental factors, basically some kind of ethnic factors as well, some kind of religious factors as well. So you need to take care of everything at the same time. Okay, always use good body mechanics to protect yourself and your patient. You know that the in we can discuss in a later lectures that in what position, what kind of position of a therapist you need to maintain that kind of position to maintain your good body mechanics or biomechanics. So your hands should provide stability, guidance and safety, as you know, but your body should also have to, okay, because your body is basically providing the force, your body is basically providing the movement, helping the patient to perform their movement. Your body is basically provide the support to your patient, so you need to take care of your body you as well, at the same time take care of your hands. So you need to consider that also, basically also. And there is some major thing as well. So we are going to discuss in the later lectures that the upper hand and top hand is the of the therapist is basically the hand closer to the patient heart, and the lower hand is closer to the patient feet. So maybe terminologies differ, but major thing is basically the performing the movement in a very good way. Okay, so grouping the motion is basically like antagonist motions are grouped together like flexion extensions. This is very good way to achieve any of the movement or any of the areas as well. Okay, activities of daily living, you can achieve that activities of daily living performing flexion extension in a combined pattern. So this is basically help you to complete the movements in a very efficient way, and patient can also remember what kind of movement he can perform performing. Instead of you can just say that this is the flexion and this is the extension, you can just say to the patient like this is how you can perform this motion like flexion extension the combined pattern. So this is also the important point. And third one was always remember first from the sometimes patient requires the mechanical resistance but not always. Okay, so remember that strengthening is something else, transitioning to strengthening is something else. But once you reach the active range of motion, so after that you can just progress to manual resistance, mechanical resistance, and we can discuss this in a strengthening chapter, in a chapter 6. Okay, when we can progress there. So this is basically the easy way to understand what kind of majorly the range of motion techniques we are going to perform in this lecture. So today, with that, as you know that we have discussed these things in the range of motion techniques, we can also perform like okay, we can just discuss one example with that, like shoulder flexion and extension. So you can understand this very in a very easy way. Okay. So what was happening here is basically we are going to start with the shoulder flexion and extension, the upper extremity. So here you can see in this picture what was happening is basically the hand place. Okay, starting from the hand placement and procedure. Patient is in a spine position as you can see here. Okay, complete spine. Grasp the patient arm under the elbow. Okay, first here you can see here. Okay, I can encircle. Okay, as a therapist, what you are going to do is basically hold the patient hand or stabilize the patient elbow with your lower hand. Okay, you know that this is the crisscross position you have to make as a physical therapist. Okay, so your lower hand is going to, or your lower hand is what was that we have discussed before is the hand that is basically near to your feet. When you are positioning in a way on the side of the patient, so where the hand that is near to your feet is basically the lower hand. Okay, So this is basically your hand that is stabilizing the elbow, and your upper hand is basically grasp the wrist and palm of the patient hand in a very grasping manner, like fingers are on the downward and thumb is basically grasping the patient palm. Now, from the spine position, it is basically starting from the complete neutral, and then you can perform like in the way the arrow is basically going towards the upward going. The arrow is basically going on the upward direction. So lift the arm through the available range, and after that, when you can complete that available range, you can just return back towards the bed. That is basically the movement of the, or you can say that the flexion of the elbow. What was happening in the second picture is basically the therapist is completing the shoulder flexion. This is basically the starting, like the mid, okay, the mid of the movement, because we have to discuss here. This is the starting, okay, from this basically, like the the other hand of the patient. You can see here the other hand of the patient, okay. So in this position, you can just start the movement, grasping the both sides and then reaching towards this here. And after that, when you can reach here and completing the picture like in the second, sorry, in the second picture. So this is the way you can complete the range of motion in the patient or shoulder flexion of the patient. Seem like that when you can reverse back from this position, like in the full extension flexion position, and coming back from the flexion position into extension position, or you can say in the neutral position, you can complete the normal extension after the flexion, okay. When you can have to perform a hyperextension, we can discuss that in the next lecture in a detail, that how you can perform the complete or you can extension or hyperextension. But this is the major way, that when you can come back from this whole position and back towards this neutral position here, where the arrow shows. So this is the extension or shoulder extension. So thanks for watching. If you have any query, you can ask, and this is all about today. Bye.